my name is Amy Growie. I'm a family physician and I also practice breastfeeding medicine. I'm a board-certified lactation consultant. I own my own medical practice called Little Flower Family Medicine, and that's located in O'Fallon, Missouri. Untreated tongue tie can have an effect on breastfeeding and bottle feeding. It can also have an effect on the ability to eat solid foods, to use a straw. It can have an effect on speech. It can have an effect on oral toilet or oral hygiene, which means using the tongue to clean the mouth. And also, it has been suggested that it may even have a role in orthodontics and sleep apnea. Certainly there are people who have a speech disorder who do not have tongue tie. However, there have been cases where babies or people who have had a tongue tie that was not treated and then developed speech, and they didn't develop speech adequately, they were delayed in speech, or they had poor articulation, and after the tongue was revised, they spoke more clearly and had improvement in their speech. So we know that tongue tie can affect speech. There's no way to know, unfortunately, in whom the tongue tie will actually affect their speech. Oral toilet, again, is moving the tongue around the mouth. So if you think about having a piece of pizza, the pizza gets stuck behind your back teeth, and you might use your tongue to clean out your back teeth. People who are tongue-tied don't have full motion of the tongue, and I have had cases where people come in and they say that their 3-year-old is sticking her finger in her mouth to clear the food out of her mouth. And she knows she's not supposed to stick her fingers in her mouth, but she has no choice because she's tongue-tied. So tongue-tie can affect oral toilet. There's a suggestion that this can actually lead to an increased risk of cavities, because if you can't clean the surfaces of your teeth well, you may be more likely to have cavities. The tongue can also affect the development of the palate and the jaw. And the reason this is because the normal resting position of your tongue is actually with the front of the tongue behind your front 2 teeth and the rest of the tongue resting on the palate. However, if the person is tongue-tied, the tongue cannot rest at the roof of the mouth at the palate. In the womb, the tongue is actually supposed to stretch the palate. But if it's resting at the floor of the mouth, it has not stretched the palate, and this can actually lead to a very high, narrow palate. If you treat a tongue tie when a baby's early, very young baby, something in the 1, 2, 3 months of age, and do ultrasound studies, you can actually see that the palate expands over time and gradually improves, gets stretched by the tongue that's resting at the roof of the mouth. There's been suggestion that tongue tie may be tied to airway problems or sleep apnea. The reason for this, if you think about it, your nose holes are right above your palate. So if your tongue doesn't go up and stretch your palate, it may also not stretch your airway up here. There's also a portion of the airway here that can have the tongue fall back and block. And so a tongue tie is going to prohibit the tongue from getting out of the way of the airway.